Hey, good morning, Dr.
Good morning.
Alfonso.
Good morning, Dr. Saylor.
Hector, how are you today?
Good morning.
Good morning.
So
Good
we're
morning.
back here at the Oxford Exchange, and it's kind of a little bit of an overcast day today, so we may not look as glamorous, in this light, but we'll do our best to communicate today's subject, which, we've both seen a lot of, we're always introducing these terms in this. The way we put it is these are kind of, for our viewers, become household terms. And as we always say, and our best patient is a patient who's done their homework and an educated patient. So we have a great household term to introduce today. Great in that it's good if we can, if there's people out there dealing with this, that they can recognize it early and maybe get some help with it.
Yep.
And we see this on a regular basis. We're probably seeing more and more of it now, currently. And so, not to keep you in suspense, but today's household term is a wraparound cavity. And so you just had a beautiful case recently that you can talk on. So, first of all, what's a wraparound cavity?
Yeah. So to define a wraparound cavity, it's a type of cavity or decay on the tooth that you might see it on the tooth surface, and as dentists, as we start cleaning away at the cavity, we can see it is at the base of the tooth, and then we start seeing the cavity go a little bit deeper. Then it wraps around in between the teeth, and sometimes it even wraps around to the back of the teeth. So it's a wraparound in the sense that it's going over a lot of the tooth structure and wrapping around that tooth.
So what's a typical cavity like?
Typical cavity is more pinpoint. It could be one, maybe two surfaces. It's not as extensive, typically.
And so what problems does this present?
So the problem that this presents is how extensive it is. So it's how do you fix something like that? If so much of the tooth structure is a cavity, how do you go in and clean that up, and how much of the true tooth is left? So as a dentist, we have to think about, okay, we can clean this up, but what are we going to do to restore the tooth?
Right, because they probably didn't teach you this in dental school, what to do with this, did they?
Not really. It's something that I've seen now out in practice, because it is more common than I thought.
Yeah.
And making that decision of what to do has come now with experience. So for us, depending on the extent of the decay and depending on the patient, we'll make our clinical decision of what we would like to do.
Right.
And what's great is we try to keep it conservative. We think about how sustainable it is, and we think long term. And we can do things like bioclear.
Okay. So I guess we should talk about, how does this happen? Because a lot of times it's with young people. In fact, most of the time it's younger patients, right? So why are these patients getting these wraparound abnormal type cavities?
So for most of the patients that we're seeing, and they're younger, we are seeing them getting these cavities when they are not keeping up with oral hygiene, maybe consuming foods and drinks that are more prone to giving you cavities, and sometimes we see most of the time when they have in the middle of orthodontic treatment.
Yeah.
It's traditional bracket and wire brace, or even an Invisalign.
Okay, well, why would it do that with Invisalign? Isn't Invisalign protecting the teeth?
Yeah, so Invisalign is the trays that you can take in and out.
Yeah.
And it is very protective, and what's great about it is you can take it in and out versus traditional braces that you leave on. The wires are covering the teeth all the time. So Invisalign are more protective, but sometimes if the patient is drinking or consuming foods with the Invisalign in, that's where the problem can persist, especially with drinks. So imagine the Invisalign, they're covering your teeth, or at least trays, and imagine them like buckets that the teeth are just kind of sitting in.
Right.
If you're drinking, let's say soda or something carbonated or high in
the
sugar,
bucket.
it's going to get in the bucket, and then the teeth are just kind of sitting in that.
Bathing in that.
Bathing in it, yeah. And versus traditional braces where those wires are on all the time, for that, if you're eating or consuming things and you're not keeping everything clean, food and things get stuck on the teeth, And that's also why just the exposure to these type of things long term can increase the chance of getting that kind of cavity.
So exactly, for parents out there that are seeing this happen, maybe, I mean, what are they looking for that their child may be getting a wraparound cavity?
So
how would they know?
They would be looking at the tooth surface, and you'd start seeing some sort of staining or difference in color on the tooth, either on between the teeth or on the tooth surface. So when it's a wraparound, as it starts developing, you can start seeing it more, starting to cover the whole
And
tooth.
a lot of times it looks white, right?
It does, yeah.
And it's more at the gum line.
Mm-hmm.
It's like at the gum line, it starts at the base of the gum line and then goes in between the teeth,
Mm-hmm.
as you're saying. And what is it about the liquid, the soda, or the drink that causes the wraparound?
So part of it's the sugar content, and part of it's the carbonation. And so the combination of both, and it's such an acidic type of drink
Yeah.
typically,
Right.
that the acid will
It always comes down to acid and sugar, doesn't it?
Yeah,
With
it does.
cavities, anyway, it's a lethal combination. You know, I would I saw a case recently, and I didn't make the connection until I was talking to some colleagues, and they were saying, "Are you seeing a lot of these wraparound cavities with gamers playing video games and doing this, and you know, even if they don't have Invisalign in or whatnot, because of the constant exposure to the acid." And I didn't realize it, but then my assistant Mark was like, "Well, you know, she's a gamer." I'm like, "What does that mean?" But I've seen it, and so I think that was another one that we could add to the list. Okay, so I think we've established what it is,
Mm-hmm.
how to spot it, and what causes it, and then why they're so difficult. Let's get into the solution.
Yes.
So, what is intuitive for most dentists to do?
Most dentists see a wraparound, which again, it's more extensive, wrapping around the whole tooth, and they think, all right, this person needs full coverage, which is like a crown or a veneer. And so
Yes, and that's crushing to the parent.
it is, especially if it's a young kid. So we think of things as a tooth having about 5 lives. So if you see a 15-year-old, let's say, and he has wraparounds, and you think, all right, he needs crowns, he's 15, so that's getting to the 3rd and 4th life of
And this
that
tooth
tooth.
didn't even have a filling in it.
Yeah, it was a tooth that hasn't had any fillings. It has all this decay now. So what's crushing to the parent is, man, my young kid now needs a full crown. And sometimes these parents don't even have crowns themselves.
Right. I mean, they may be in their 40s or 30s and like, I maybe have 1 crown. How come my child's going to have 12 now?
Yeah, because it's not one tooth that typically gets these
Right.
wraparounds. It tends to be extensive, maybe more than 5 teeth. I mean, we've seen it as extensive as top and bottom teeth.
And so if you're starting out with a crown and you're already skipping life 1 and 2, and then we talk about the more tooth needs, especially at the age of 15, what's the likelihood they're going to have that tooth at age 50?
Way less. Yeah, it's not. It's more prone to needing more work or breaking off in the future, needing more treatment. So yeah, it's less likely. We have the option of being more conservative and sticking with the 1st or 2nd life of the tooth by doing bioclears. So I mentioned bioclears as a conservative way to do it, because versus a crown where we prep away a lot of the tooth structure and we're covering the tooth with something made by a lab, our bioclears are one layer of heated composite, which we injection mold to cover up and clean up the decay, cover it up, and restore the tooth to a natural, healthy state. And keeping it more conservative, because we don't need to prep or prepare the tooth like we would for a crown. So the bioclears are wonderful in a case for someone who's young, because they can be sustained. If anything, they might need maintenance, and that can be maintained or repaired. And it's more conservative, where we're not jumping to putting a crown on someone who's so young.
Right. So, I mean, that's a good point, because you say they can be repaired. Can't a crown be repaired?
Not so much. Typically, if a crown breaks or chips,
You need a new crown.
You need a new crown.
Right.
Yeah, that
Which
happens
is
a lot.
expensive.
Mm-hmm.
So what happens if a bioclear chips?
So if a bioclear chips, we can repair that and kind of bevel the surface and clean it up and be able to build that part back. Because typically it won't chip or break the same way a crown will. It might have some chips on the edges because they're repairable, similar to how we do them in the first place.
Yeah, so it's not going to cost as much as it did originally to do the full bioclear. So you end up with just a traditional smaller filling as a repair. So I think that helps tremendously because this is a game changer. It's a huge advantage. And what are the chances that if you do a bioclear or a crown, that these wraparounds are going to keep going?
If we can talk about the patient's oral hygiene, if we can try to watch out for those factors that we've talked about, the energy drinks, the soda, the sugar, and keep those controlled, most of the time we can keep these cavities from coming back. So it's a bit of teamwork between us as the dentist, having the patient come back for their checkups and consistently seeing them to make sure everything's doing all right, and the patient's job at home.
Yeah, and I think the point that you're making there is the onus is on the patient to take some responsibility and to get rid of the cause of it. So we can repair the damage, but it's not like once we repair the damage that the problem is solved. Now, again, going back to an educated patient and us helping the patient understand the cause and effect relationship, now we can work together with that patient and the patient understands what their part is in preventing this in the future. So, and that's important because we don't want to see a patient expend the energy, time, and money to fix this, and we feel all excited, and then we see them in 2 years, and they have the problem again. I mean, that would be crushing. And so this is a concept that, you know, we want to make sure patients understand is the things that we're doing are great. They really are. But we have to have you understand that there's a responsibility on you to maintenance this and understand the value of the checkup. Because the checkup is, I always say I'm paranoid. I tell patients, I'm going to be paranoid about this reoccurring, and what do I like to see? 3 years without a new lesion. And 3 years without a new lesion tells me that now the bacterial flora is different. So the cavity causing bacteria, if we can keep them away from for a good 3 years by changing habits. Remember, you can't continue with the same habits because you're going to still have the same bacterial flora. But once you can change those habits, you're going to get different type of bacteria. Now, you're always going to have bacteria. I just brushed my teeth 10 minutes ago. I have new bacteria, but they're not pathogenic bacteria. And they also don't smell. But after a while, these bacteria, if they take over your mouth, the pathogenic ones, not only do they smell, your wife's going to complain about it, and mom's going to complain about it, but they also destroy the enamel. So these are things that will get you in a habit of being able to spot. We know how to treat them. We know what causes them. What else would you add to this subject?
Oral hygiene tips. So for wraparounds, let's say you're not in any type of ortho treatment, making sure you're flossing, brushing consistently. And if you are in some sort of, like, let's say braces, the wires are typically going to be kind of in the way, and you might say, oh, I'm not going to floss. I can't floss. You have tools. There's tools out there to help kind of get in between the teeth and keep things very clean.
Well, what if you find yourself in a situation where you're going through Invisalign, or you're going through when you have brackets on, and mom spots some of these wraparounds? What do you do?
You want to address it with your dentist. So you want to bring it up and have it looked at. And so that can be going to a dentist, and maybe we need an x-ray to see what's developing there.
Well, would you have to stop treatment?
Depends. on the extent of the cavity. So if things are getting pretty extensive, you want to take care of that cavity. You don't want it to sit there and spread, because once that bacteria is there, it needs to get cleaned out.
I would agree with that 100%. And that's a tough one, right? And we've had to do that.
Mm-hmm.
And it's like, hey, first things first, let's stop this treatment. Let's fix the problem. Let's get it under control, and let's commence
Mm-hmm.
with the orthodontic treatment after things are under control.
Mm-hmm.
And it's heartbreaking when you have to do that, but it will save you a lot of problems, because the earlier you can catch this, the better.
Oh yeah, absolutely. And in terms of being an Invisalign, it's might be a little easier to spot if you're in some sort of bracket and wire braces. To treat, sometimes we need to take off that bracket. So catching that early, working with your dentist or your orthodontist,
Yeah.
and getting it addressed as soon as possible.
Right. And so, what's the biggest risk with treating these lesions?
The depth of those lesions, once you get a cavity like a wraparound that can extend around so much of the tooth structure, you worry about how's the tooth, the nerve, and does this tooth maybe need
You're going
a
to use
root
the bad
canal?
word.
Oh, yeah, the bad word. Yeah, a root canal.
Yeah.
So not to cause any fear, but when things start wrapping around the tooth and so much of the tooth structure is getting affected by the cavity, it's that trauma to that nerve and the risk of that tooth becoming symptomatic or having issues where it would need something like a root canal.
I would agree, and it's an important thing to understand as well is, these things don't hurt, do they?
No.
It's amazing they don't hurt. And the worst thing for us, and we've talked about this until we're blue in the face, but it's important that this becomes a household understanding as well, is the common scenario, and we won't go into detail now, we've done other blogs on this, but it's like, gee, it's great, my son's teeth look fantastic, and we're so grateful, but he's developing a lot of pain, and what did you do to cause that, right? It's the worst thing.
Mm-hmm.
And we have always been upfront and transparent about this. It's as Dr. A is saying, it's the trauma from removing this decay, and if we've gotten to it too late, it's not like you're going to lose the tooth, but you're going to lose the nerve.
Mm-hmm.
You're going to need a root canal. And surprisingly, we found that with these wraparounds, they go wide, but they don't go as deep.
Mm-hmm.
A lot of the times.
Yeah, a lot of the times. It's a true wraparound where it's in between the teeth, sometimes on the top surface of the teeth, but so far from what I've seen, it's not going into the nerve. But it's a risk that we need to talk about ahead of time, so everyone's on the same page and understands what we're watching out for.
And the thing to remember is, if you treat it, the risk is there, they're going to need a root canal. But if you don't treat it, 100% you're going to need a root canal. Mm-hmm. Not only that, you're going to lose the tooth. So these are serious issues, and patients need to be aware of them, and it's a great technology that we could use. It's a win-win for everyone, absolutely. So I think that was fantastic. Thank you so much.
Thank you.